What's up, guys? Thursday. Here we are.
I'm so excited. I'm so excited. Erica knows
Doctor.
my funniest story ever, or most embarrassing story ever.
When you lead it
Dr.
in like that, now everyone's going to want to know.
That's good. They're
But
going to have to listen. Maybe we'll drop it later. It has nothing to do with what we're here to talk about, though. So.
Yeah.
that's true. Although the meandering way that we
It
have a
happens.
tendency to go. I was really excited. I was actually thinking, I'm like, oh, I'm tired. Like Thursday night is hard. At first I was thinking like, what better night to talk about gynecology and sex? Like, let's do it at night, not during the day.
It is a Thursday night topic. You're right.
Hard.
So I will tell you, Matt knows if I'm in my scrubs from the clinic shift, I've either had the shit kicked out of me the entire week or I'm half falling asleep. Either way, he's carrying the entire conversation.
Yeah.
I saw your name on the schedule and I'm like, I'm fucking putting on my Sophia from the Golden Girls shirt for you because like hilarious. I got fucking excited. I needed a win this week and I think you're it, Erica.
I think you're it. Yeah. Listen, we should actually say real quick, Dr. Erica Kesselman, hello and welcome. Like just real quick. I mean,
hi, gentlemen. Yeah. I'm so excited to be irreverent on a Thursday night.
Well, let's do it.
And listen, I am so psyched, and we got to tell everybody because we got to pimp out MZ any which way we can. But you and I got to hang out tonight at another event, which was super fucking cool. I mean, you know, this week, just a couple days ago. And MZ, man, that was quite a show, man. He put on quite the piano book reading comedy show. Wasn't shit like it was fucking awesome. Like every part of it.
It really was. It was a masterclass in survivorship, in vulnerability, in tribute to family, and that it takes a village, in people that he inspired, in people that inspired him. It was sort of a massive love fest, and there were probably 200 of us there.
Nice.
And I feel like he made eye contact with every single one of us. And I feel like he knew every person in that room, not just by name, but by story.
Oh, yeah.
And that's a gift.
And what I also loved about that was it was like such a masterclass for me in like not giving a shit about where you're going to end up, just doing the thing that feels like directionally accurate right now, even though you don't really know where you're going. So fucking hard. And this dude has made a art form out of not knowing what the next step looks like, but doing it anyway. And I have to say it was real inspirational. Hearing that because his story is crazy. Yeah, he's been on the show.
We've been on his show.
Yeah. We've been on his. So like it's easy for people to go look him up and you know, I get to gratuitously pimp out another show of ours.
and we had such a great time. We got a chat going with him too.
Irreverent Health episode. Yeah.
Yeah, I mean, he is just, and I mean, the people he was bringing on stage were just, they were fire. They were just
they were next
amazing.
Level. What was interesting about that too is every organization he ever helped found or participate in now is huge, national, and the people running it are ballers. Like every single one of them. It's like crazy.
Yeah.
I mean, I know he's not getting up there talking about the things that failed, but from the optics outside, he's batting 1,000, this dude, you know?
Yeah, which means his book is going to be through the roof. We can totally push his book. I think I have it on my shelf.
He signed my book, The Other Man.
The Other Man. Oh, that's great.
Like We the Patients.
Yeah.
Yeah, I was not able, I was so fried by the end of that night. I had been in Pittsburgh for the weekend visiting my daughter in college and then did a 24-hour shift on Monday, hopped on a train Tuesday, took care of my aunt who's sick Tuesday afternoon, and then went to the show. By the time the show was over, they were like, okay, the VIP is upstairs. I'm like, all right, bye guys. I don't think I'm a VIP. They're like, yeah, you are. You've got the bracelet. I'm like, oh.
Yay.
I'm excited about the VIP, and I have such FOMO. I hate missing out on stuff.
Yeah,
so I'm
for sure.
You guys are killing me with the FOMO right now, to be honest.
Listen, I brought you back.
Where were you, Tom?
I brought you back some stuff.
I emailed MZ a break a leg email, and I said in a very near and dear topic to our heart. I can't take off work because Care First owes me $20,000.
Wow.
So,
Wow.
it was a glitch going back to January 1st. And now I'm going to call them out by name. And if my 3D printer wasn't broken, I'll infer it that way because you can't make a joke.
Understood.
It is appalling that they're letting this continue.
And it's not just little acupuncturists. It's like
no,
fucking
totally.
hospitals. It's everybody in the state. Oh,
Hey,
shit.
Tom, you're
Yeah.
Frozen.
He'll come back.
I think they cut you off. They heard
they
you.
did. They saw
And now
him
you
coming.
no
They
longer
heard
have
his
access.
voice, and they were like, "Nope, fucking way."
Blocked.
Yeah, like, don't worry. Riverside makes it all pretty again in the end. So we should probably get paid by
No doubt.
Riverside one day. You know, if you're listening, Riverside.
Yeah, I feel like that
Riverside.
was a direct attack from
Yeah, a direct
some government agency.
Is like,
Because there's
shut it
no
down.
reason I should be getting, slagging now, right now.
Yeah.
So if I say the name Elizabeth Potter, maybe that I'll start
Then
getting
you'll all of a sudden
Yeah,
get
yeah.
buzzed out.
Dr. Potter and,
Yeah. I
and
you know,
Red
I
Bud
think
Surgery
it's,
Center.
while Tom is going to find no solace in this whatsoever, I find it just so funny that the reason he had to miss MZ's appearance was because of shitty health insurance problems. Like, there couldn't have been a more perfect reason for Tom and Genio to not go to MZ's thing. I mean, seriously, you couldn't have scripted that. You know?
Legit.
Like,
It's true.
I mean, it sucks he wasn't there, but it's also like the best story I'm ever gonna, like, this story is like so perfect.
This is where, Tom, you're going to get like a VIP seat, or you'll be reading at his next show.
Mm-hmm.
He'll,
I
like,
might
elevate it
be
and say-
sitting in a cell next to Luigi, to be honest.
Yeah. Yeah. I mean, I don't know how they legally get away with this nonsense. Some like compu nerd should figure out how many dollars in interest they're making by not fixing the glitch per day.
Well,
It's
yeah,
probably a fortune.
if I guarantee if their payroll had a problem, that'd be fixed in minutes.
Hmm.
Right, but like,
Or
imagine
their
what they're making.
boat.
They're raking in boatloads of cash.
yeah. Compound interest on everything, absolutely.
Yeah.
And it's funny because like Matt knows I got a couple of ins with local media. Well, guess who advertises every commercial during the news? Oh, Care First.
Yeah.
Oh, we don't want to lose millions of dollars in advertisement.
Oh yeah, it's
Yeah.
beyond ridiculous.
The question becomes, what are they caring for first? Like,
Yeah,
care
certainly
first.
isn't fucking
but
Indian
what
time.
CEO.
goes in the middle?
The
Yeah.
CEO.
Care first for my bank account.
Yeah,
Yeah.
No, it's fucking criminal. It's really obnoxious, but thankfully Tom's
Anyway.
going through it, and we could talk about it and make a show about it.
Yeah.
There we go. And are
Yeah.
any of you going to Portland for the next big screening
I
of Suck
cannot
It Up,
go
Buttercup?
out to Portland at the
No,
moment.
I would love to.
I've
'cause
never been to Portland.
I think I was definitely in Seattle. I might have been in Portland. I did a lot of there's a lot of acupuncturists out there that have some really
Yes,
good
there are.
seminars. So I'm trying to think back if Portland was one stop.
Are you heading
Speaking
out
of
there?
acupuncturist, Erica, we got to tell you
Yes.
this.
Tell me this. I got your text and I was like,
Oh, man.
This is so bizarre.
So we had a forager on, Amelia South. She was brilliant. And she started to say how much she loved acupuncture. And it turns out it's your fucking brother. Like,
That is so wild.
We're like, wow, this thing just keeps producing
She's
connections
like,
for
oh,
us.
I know him.
That is so wild. That is so wild. But I love it. I'm gonna have to tell him he's famous.
Yeah, I mean, he's been mentioned now twice on our show.
on our
I
show.
know. Maybe you just need to get him on the show.
Well, hey, look,
I mean,
man,
maybe.
we had an acupuncturist who's been out for 40 years, and it was like so great to talk to him. And he had a little moment. Matt said he was jealous because there was this like a little exchange between us that was really nice.
Yeah.
But yeah, we will.
No, he should come on. Let's get him on and talk about acupuncture. You can never have too many acupuncture conversations.
No.
Extended family now.
He is. He's
right?
He's in the club.
Yeah.
I love that I'm in the club.
There
you
you
guys
go.
are great.
Yeah.
So
we joked about getting a jacket like for 5 timers like SNL.
Yeah.
Oh, dude, what do I do to rank for
like
that? I'm going to leave you with a cliffhanger every time because last time I was like, and hormones are going to cause cancer.
Let's go.
Let's do that. Listen, only because I want to say this because I keep planting the seed and it'll make me have to do this eventually. I think the t-shirt thing has legs. So I think too. Before this year is out, every show is going to have its own t-shirt. Every episode is going to have its own t-shirt.
All right, we gotta plug it into the AIs.
Yeah.
Yes. So where do you guys get the artwork for each of
I have 2 art degrees, Missy. You leave.
Do you make them for each individual based on like?
He made the AI that makes them for each individual.
Yeah. Basically,
he made the paintbrush.
But yeah, exactly, and the paint and the canvas.
Yeah,
we're that old.
Yeah. No. I mean, I'm saying like our system is really crafted down to that atomic level. Like, I mean, we basically have a very strict formula. I mean, it's building these things takes a long time, but the scale at which they operate when they're done is really fun because
I love mine. Like I saw my last episode went up, like the fact that there is a butterfly and the fact like I want a copy of that. I want to put that somewhere. That's
easy. Yeah, we can do that easily. Yeah.
Matt will sign it for you.
Idea. That's a cool idea too.
No, like I'm serious. I'm going to tell you, like part of Irreverent, like your podcast is about weird connections and, the fact that my brothers come up multiple times. Recently, butterflies have been coming up a ton, including in between when we recorded and when I met you guys, which was probably a week later. I think I saw you. We recorded on the 13th and I saw you on the 19th for the
movie.
Yeah.
Right. So, crazy enough, I mentioned hormones can cause cancer. We recorded on the Friday the 13th. I had my screening mammogram the following Monday. Screening mammogram, I've had 15 of them and it came up positive.
Oh no.
I had my biopsy the next day and found out when I was headed to Baltimore that it was positive for cancer.
Oh my God.
So and MZ was the only person I told that night. So that night while we were getting a little shitty drunk, I was getting shitty drunk for a totally different reason.
Allegedly.
But I'm sorry, they're celebrating the moment.
Yeah.
But it was this wild sort of progression of events. But one of the things when I went in and then a week later had a lumpectomy and now disease free. Like I'm
all right.
Good.
Thank God. Thank God.
Yeah, sorry.
All right. You are my Erica. You are my win tonight. Thank you.
Yeah.
Thank you.
So when I told MZ that night, it was like toward the end of the night and I had a couple of drinks and I had told him and he was like, I've got the perfect thing for you. And he goes on his phone and he looks up and he hands me his phone and it's a little emoji of him, like his little Bitmoji guy. And it's like, there's no fucking Hallmark card for this.
Yeah.
Like,
nice.
And yes. But at that point, like I didn't know what it was going to be. But the next week when I went in for my lumpectomy, I had to get a needle localization. So they basically take the big ass needle and they put it in where the tumor is so that the surgeon knows where to go. Mm-hmm. And at my little teeny tiny hospital, I can't believe I've worked here 20 years and I had no idea this wall existed. The radiologist who was going to be putting the needle in came up to me and said, and the day that I had gone for my mammogram, I had looked on the wall and they had all these butterflies and it says, make today amazing. And there are these butterflies around it. And I'm like, what a cool thing to look at while you're getting your mammogram. And, social media is kind of my new thing. I'm seeing if I can help, facts over fear. And so I had been videoing everything. Like I was like, I'm going to make content of how easy it is to get your mammogram. So I videoed my mammogram. I'm like, I'm going to make
So you have all
content
this shit
how
on
easy
tape.
it is to get,
Oh, wow.
in real time.
Oh, YouTube will hate that though. They will definitely call that pornography.
Well, no, I mean, I was discreet.
I know.
So
no nip slips in this one.
Later,
Is that what you're trying to say?
Yeah, right. A week later, I'm going for my lumpectomy, and the radiologist comes with a box of butterflies. Every single one is different. And he's like, every single butterfly on that wall is a cancer diagnosis that we picked up at our hospital.
Oh,
Pick
shit.
your butterfly and become part of the flock because you're not alone in this.
That's wild.
And I was like, this is one of the most beautiful things. And, you know, it was just, everyone was different, but everyone is part of this support system and this flock of, is that what you call a big group
I
of
fucking know.
I was going to look. I'm like, they're bugs, not birds. So
right.
Yeah.
It's just a cohort.
I bet you it's
a
something.
family.
It's probably like a flutter or something.
Thing. Yeah.
Right.
A murder of crows is the only one I remember because it's like so sinister. It's like
it's a kaleidoscope. It's a kaleidoscope of butterflies.
First of all, that's awesome.
That is like perfect, though, isn't it?
Second of all, I think my kids told me that once because as soon as you said that, I'm like, oh shit, I think I've heard that before. My kids got on a plural animal kick one time. You
have to ask them if the plural of moose, if the plural of mouse is mice, is the plural of moose meese.
I insist on that just because I know it drives my kids crazy, but I've been instructed that's not the case.
Oh, it's just moose.
Yeah, I think it's just moose, yes.
So then when the episode came out, so I talked with you guys like literally in this little
in the storm. Yeah.
Sure.
Right? And then met you guys in the window. And then when the art came out for mine, it's a kaleidoscope of butterflies.
That's fucking crazy.
Wow.
So we definitely can get you the high res of that image. That's very easy enough.
I had to share that. It was just
that's awesome.
I needed to figure out how it happened, but yeah, you guys create magic and it's awesome.
Oh, thank you.
Oh, that's very sweet.
You know, if you want to get real fucking nuts for a second, this could all be explained.
Tell me.
Because quantum is fucking real. And that computer created something, but that computer created something from my imagination to my fingers.
Chaos magic.
To the keyboard circuitry, to the wires of the internet, to the cloud. It went through all of these channels, broadcasting its quantum signature the entire way. Universe being what it is, picked up a vibration of that, knew what to do with that information. And when the time came where we scrubbed the transcript of your show, ran it through our blender, out came the only fucking right answer for your show. And that's, if you want to go down the weird route, that's the answer to the question.
I love the weird route.
I was going to say the same thing, man. It is call it reverse causation, which is like a real physics thing. You know, and I was joking about chaos magic, but chaos magic is pretty much quantum theory. Yeah, it's very weird.
Depending on what circles you walk in, this is actually almost predictable, all the way to not at all.
And it would be you. It would totally be you as the guest. It wouldn't be another guest.
Right.
What do you
mean? A lot of our shows actually have some
pretty decent art. Like whatever you said at the screening, right? You stood up and I went, wow, you're hippier than me.
Yeah. Yeah. It's funny.
And I'm a scientist. I'm a doctor.
You're a doctor. Yeah.
Listen, I think you could be weird and be a doctor all at the same time. Like, I don't think those things are mutual.
I think if you're a good doctor, you're a little bit weird.
You have to be weird. Yeah.
Because especially in doing what I do, like I can walk into a room and get a feel, and it sounds wonky, but I can really, it's a feeling of what the woman needs in the moment to get her through her labor. And I don't remember who I was talking about this with, but there have been times when I've been in a birth and someone else walks into the room and labor arrests. Like a woman will be like dilating, gets to 8 centimeters. Her mother-in-law walks in the room, or a sibling walks in the room.
Nope.
Everything stops. Like contractions stop, dilation stops, totally stops. That person leaves the room. They're fully dilated, deliver their baby.
Wow. Vibes
it's
off.
like,
yeah,
vibes off.
Yeah. It's just, and if you think about animals, and we're animals,
Sure,
essentially, it's, if an animal feels safe, they'll reproduce. If an animal doesn't feel safe, they won't.
Sure.
And that's where, we force pregnancies with in vitro fertilization. But I think we discredit stress in our lives. We don't see it as what it really is. And it sabotages our system. It sabotages our biology. It short circuits our well-being. And, when my brother and I talk about like what people think acupuncture is going to be, he's like, yeah, they think it's going to be totally like, I can fix everything with energy.
Yeah.
And, I can fix a lot of things, but you got to buy in. Like, I can't do it for you.
Sure.
And it's, energy is real. Stress impacts all of that. Our hormones are big, and our energy is just huge. I mean, I'm doing a workshop in 2 weeks, Mother's Day weekend, so a week and a half, doing something called heart math.
No, I'm trained in that. I'm actually certified.
Really?
Yeah, I am. Look, oh shit, where is it? I have the device right here somewhere. I'm not going to tell you I haven't cleaned this office in forever.
Yeah.
There's someone that I'm partnering with 2 other women. And it started from just this funny idea that I had. One of the women does therapeutic animal husbandry. So she does like work with people with PTSD and autism with her horses. And she has,
we had
donkeys.
What's her name? Her last name's Callahan or something. Oh my God, she was such a great guest. I just saw her on LinkedIn too. I just thumbs up something she just posted.
So, this woman, Cheryl, was involved at the workshop I was doing, and she does a lot of this stuff. So I was joking with her. I said, wouldn't it be cool if we did a workshop together called Mares and Menopause? Because Premarin is pregnant mare urine.
Pregnant mare urine. I love telling people that.
Right? And 2 of her horses were offspring from the mares that initially were creating. They were treated terribly.
Yeah.
Carmen.
What's her last
Theobald.
name? Theobald. Wow, it was off with the Callahan all together.
Carmen Theobald. She does non-judgmental equine therapy. Like, it's like really fucking cool shit.
Yeah, she had a great story too. Yeah.
So we're combining, I'm going to be working with women kind of explaining menopause, and then we'll be doing heart math and working with the animals to really get into the vagus nerve and breath work. And, for people who aren't taking hormones, can't take hormones, don't want to take hormones, giving them tools to say, okay, if we can tamp down your sympathetic system a little bit and ramp up your parasympathetic by stimulating your vagus nerve, let's do that and see if we can channel it to help with hot flushes, night sweats, insomnia, all of the things that you get with menopause. Because yes, hormones are great. And until this whole, I can't really say like the whole cancer thing without saying, until I got a little bit of cancer, like until I got a little bit of flu, I had to come off my hormones. And so legit, I fucking hate it.
Yeah.
I love my hormones. I've
had some people who are breast cancer survivors who have made the decision to go back on. So they're like, I just can't function like this.
Walk me into what the problem is, because I one of the things I was, aside from talking to you again, one of the things I was mostly excited about is to try to learn more about this, because I really don't understand the link here or the suggested link or the, what's the relationship between the cancer thing and the hormone
thing?
Here's
the thing. And I just sort of, it was total like clickbait kind of like, hey, I'm going to leave you with this. Peace out. See you later.
Did you? Do you think you did that to yourself?
Not. No, I do not.
No,
I
sorry.
do not.
I'm sorry.
No.
Did you will
I
yourself
honestly,
breast cancer?
Yeah.
If I did, it grew really fucking
Really fast.
Yeah.
really fast. In 3 days, there it was.
You've got what they call clickbait cancer right there. That
Clickbait
grows
cancer,
at a whole different speed. You know what I mean?
Yeah, no, that's never what I want to do.
No.
In any way, I don't want to be clickbait, nor do I want to be cancer.
Yeah, for sure.
But what I was getting at and what the disservice, I think, so just to kind of rewind back to where we were, where we left off, there is so much broken in medicine that doctors no longer have time to really talk to their patients about anything. And menopause is a long discussion, especially now that there is so much fear mongering online and in the media, and there's so much misinformation. Everybody's trying to sell people anything they can. And so the supplement industry has gotten on the menopause wagon. A lot of naturopaths, a lot of estheticians have gotten onto this bandwagon of, I'm going to sell you stuff to make you feel better. And when placebo effect is 40%, that's awesome because you're going to get a great response. Like almost 50% of your people are going to have a response from sawdust capsules that may or may not have anything in them.
Right.
Matt and I are launching our brand of sawdust capsules for menopause symptoms. It's called Meno RX.
It's only
Pick it up. It's only $29.99 for a day.
And you have to take 17 pills.
And we've already set it up on auto ship.
Yeah.
You're already subscribed.
Awesome. Yeah. I think you need to market it at 2:00 in the morning when all the menopausal women are waking up.
Yeah, they're covered in
with
sweat.
their hot flashes.
Every body part is hurting.
Yep.
They doom scroll and then they will buy everything.
And in unrelated news, Irreverent Health hires Dr. Erica Kesselman as their chief marketing officer. Completely unrelated to this topic.
I'm down for it. Totally down for it. But all of these online program, like I don't want to name them by name, but there are all these online,
whether it's for him or her or a guy named Roman.
Yes, or
not
if
Greeks,
you're
but
at the beginning, the end, or the midi point. So we didn't name anybody. We just had a conversation.
I will call out Care First again, though.
There we go. And do you know why? Because they care first.
They do.
Not second or third.
No.
They're the most caring. They care first.
Yeah.
So anyway, all of these companies have telephone doctors and it's telehealth or nurse practitioners or whoever is staffing this. And you meet with them once or twice, but then you kind of go down this algorithm and then you really don't have somebody that you can rely on as a patient if there's a complication. So let's say you are using one of these online services and you start having postmenopausal bleeding or perimenopausal bleeding, or your bleeding starts getting heavier, and then you need to get in to see someone. Well, who are you going to see? Are you going to see an overworked GYN to get in to see me is going to be a 3 to 4 month wait because there are fewer and fewer and fewer of us because we're getting kind of pushed out of the system. It doesn't pay for us to practice anymore a lot of the time. People are retiring early. They're burning out. I mean, part of this whole healthcare crisis is burnout from physicians because patients come in and they're like, oh, these are the hormones that I was given online. Can you prescribe them for me? I'm like, hey, you know what? I did a shit ton of schooling and I'm not just a menu where you can check off what you want and I'm just going to write you a prescription. I want to care for you. I want to make sure those prescriptions and those medications are correct. I want to get to know you. I want to make sure that your needs are being met and it's not something else. Is it your thyroid? Is it your adrenals? Is it something? And for someone to come in and just say, well, this is what I want because I saw it online. It's a little rude. But
it's not just rude, but it's completely
it's disrespectful.
Short-sighted.
And it's poor care.
Yeah.
So people come in now with their prescriptions, they're seeing their hormone replacement doctor, and then they want to come see me. And then they want me to take over prescribing exactly what that person was prescribing, whether or not I believe that it's indicated or not.
Why do they want to make a switch? Just because you're easier, you're local? Like, what's the what?
No, because she's saying they're coming in with a symptom that they can't get addressed, you know, so they're bleeding now because they're taking too much hormones or something, or they're losing their hair, or you know.
The compounded, unregulated hormones that they're getting are expensive because it's cash out of pocket.
Sure.
And if I can prescribe something that's similar that their insurance is going to cover, then they want to come to see me. But the other thing is, and honestly, this is the bigger issue, is just access. So, you know, it's about a 3 to 4 month wait to get in to see me. There are other doctors that it's like 6, 7, 8 months to see.
Oh, yeah.
Yeah.
So let's say it takes you 3 to 4 months to get in to see a gynecologist. The gynecologist then is going to say, okay, we need to do an ultrasound, maybe an endometrial biopsy, and we need to find out more about this bleeding. And then the results of that take another week to 2 weeks. If you decide you want to get the biopsy on that day because you're blindsided by the fact that this might be something abnormal. So you need to wrap your brain around the fact that, okay, we need to do additional diagnostic testing, and you might need to stop your hormones. And then by the time I get answers, it's already been X amount of months. But that's also once you decide that you want to see a physician or a advanced practice nurse practitioner. Because sometimes you can have your symptom, you call the online person and they change your hormones without ever seeing you, diagnosing you. So sometimes it can take 6 months to a year for you to realize this isn't getting better with the organization that I'm going to.
Right.
So I want a second opinion. And then by the time you actually see a person, it may have been a year that this has been growing. So it's really, you have instant access for what you want, and they're going to give you what you want. But it may not be exactly what you need. And that's where I think we're going to start seeing delayed in diagnosis and delay in care, because people just aren't having access to face-to-face in-person care. There's nothing IRL.
So what's the corollary, though, with increased cancer incidence and hormones? Is this like kind of a growing known, or is it still speculative?
No, I think the growth is going to be from the delay in diagnosis, from the indiscriminate prescription of hormone replacement therapy in women in every age. Like, it's now, okay, joint pain is caused by menopause, and I can give you the list of all of the things, and yes, that's true. But when I have a woman who's 68 years old who's been menopausal for 18 years, and she's like, well, my body is hurting, can you give me back my estrogen? It's probably not a good decision. Like, that joint pain, like, that ship sailed. There is a window in which it's really effective, and then there's a window in which you're turning switches back on. It probably shouldn't be turned on.
Interesting. And what would be some of the, like, I mean, is there any kind of like contextualization you could give on that part? Like, cause I know nothing about this topic. So
average age of menopause is 51.
Okay.
So if we think about, and all the GYNs are now saying this, menopause is puberty in reverse. It takes 15 years for us to go from girl to adult woman. From that first little breast bud until full grown woman is about 10 to 15 years. For menopause, it's about the same. You have this decline in hormones as your ovaries stop producing estrogen and progesterone. The eggs are where that comes from. And so your hormones start to taper down during that time. So if you are still menstruating every month, or if you're on a birth control pill where you're getting estrogen or progesterone every single month, it's hard to diagnose perimenopause or menopause because you're still getting enough hormone every month to mount a cycle. But as it gets more and more irregular, adding in a little bit of hormone to help with symptoms. Do you need to have hormones when you go through menopause? Absolutely not. You don't have to have them. If you're not having symptoms, menopause isn't a disease process, it's a natural progression. So the fact that it's sort of been pathologized as a disease process.
Yeah, I was just thinking about that.
Can I ask, a lot of your specific specialty is treated like that, though. You're an OB, right? What is more human than having a kid? But we treat you like a sick person.
Yeah. Although on the flip side of that, it's yes and no. I mean, your entire body's physiology changes, which is extraordinary. And that's sort of why I love what I do.
Oh, it's absolutely crazy. It's the weirdest thing in the world.
It's extraordinary. It's awesome. Like the fact that a woman's blood supply increases by a third, like you have a third more circulating blood volume when you're pregnant and it's just the liquid part of your blood, because when you deliver, it's a bloody process, but you're losing the liquid component, not the cellular component, because you've diluted your blood.
So your hematocrit really doesn't drop that much then? Like if you were to take it right before delivery, what are we seeing there?
So it can drop depending, but it drops at the 28-week mark when your blood volume is maxed. So we call it physiologic anemia of pregnancy. So at 28 weeks, H&H's are lower. Your hemoglobin hematocrit can go down to like 10 and 30 is still considered normal in pregnancy. It's anemic for anybody else, but you have this hemodilution that naturally happens so that after delivery, your body can recoup faster because
is that just because you lose the liquid volume and so the concentration
you lose
stays?
volume, but your body can concentrate better.
That's fucking wild that our bodies figured out how to do that shit, isn't it? Like that's crazy. Like
a woman's body is extraordinary. Like one of the things that's not pregnancy related is, and I'm going to talk about.
We're
sex,
all in agreement, weirdly.
And I'm not even gay. But we utilize that in such a different way. But one of the things that happens, and I'm sure the sex witches have talked about this, and I haven't listened to all their shows, but I'm sort of a little obsessed with them.
They're awesome.
They were great.
The Masters and Johnson, when they did their whole arousal, desire, arousal, climax, and then the detumescence phase or the refractory phase.
Is that when you say, do you want me to call you a cab?
Yeah.
Sorry.
It's a kaleidoscope.
It's a kaleidoscope.
It's a kaleidoscope.
Yeah.
So that's when it's like, I gotta go now. Peace out.
Yeah. Just remember, I've got an early meeting.
I got a thing early.
I gotta go. So it's not you, it's me. But one of the things that happens during that phase that they actually documented, and this is where when people come into my office and they're like, sex hurts, I'm like, okay, tell me about foreplay and tell me about what happens beforehand. Like, tell me a little bit about your sex life. One of the things that a lack of foreplay is one of the main reasons why women have painful sex, because during foreplay, the vagina lengthens.
Mm-hmm.
Why does the vagina lengthen? Because the uterus moves up and out of the way. Right. So the uterus actually moves as part, like if you ask a woman before orgasm, like during that arousal phase, they feel this deep pulling inside their pelvis as the uterus moves, so that with penetration, penile vaginal penetration, the penis doesn't bump into the cervix because the uterus has moved and the vagina has lengthened. Here's the best part.
I mean,
the mucosa cells of the vagina are cuboidal. So they're kind of square. They flatten out as the vagina lengthens and the cytoplasm gets pushed into the vagina, creating lubrication. That is one of the ways that women get lubricated, is because the vagina lengthens, the cuboidal cells squish the cytoplasm into the vagina, creating lubrication, moving the uterus out of the way so you don't bump into the cervix. It's like the mechanics and the ergonomics are extraordinary.
Wow.
So there's this kind of thing that's becoming a buzz term now. And I'm not saying it doesn't exist, because it absolutely does. But I'm seeing so many physical therapists and so many women going to physical therapists for pelvic floor issues. How much of this,
God.
but how much of it could be explained by just lack of foreplay, lack of warming up, lack of these things versus an actual pelvic floor issue that is causing the pain?
So some of it is painful sex results in painful sex.
Okay.
So if every single time we met, we had a great conversation, and at the end of it, I kicked you in the nuts.
Sounds like most of my dating career.
Yeah. No idea what you're talking about, Doc.
Yeah, your girlfriend told me to bring that. Your ex-girlfriend told me to bring that up. So by the end, like, as the conversation was nearing a close, there'd be a little bit of shrinkage and a little bit of pulling up and a little bit of pulling
like
away
almost
and a little bit of
Pavlovian.
guarding.
Yeah.
Right. Because you'd be guarding for it. Well, if you start having painful sex you can start foreplay and it can start out good, but toward the end, there's going to be an instinctive and involuntary tightening of that musculature. So learning with biofeedback, the ability to relax the pelvic floor as well as tighten the pelvic floor can be really important. So a lot of pelvic floor physical therapy is, and I'm so excited that more and more people and physical therapists are getting into it because it is so important. But a lot of times they'll use manometers and they'll use electrodes inside the vagina to help a woman connect her mind to the muscle in the pelvic floor, because we lose that. And having a baby, we lose that. With urinary incontinence, we lose that. And some of it is we get taught really bad. So women can go into pelvic floor physical therapy for lots of reasons, from painful sex to painful sex after a baby. And that can just be mobilizing scar tissue, or for urinary incontinence, or for increased laxity or prolapse. All of those things, pelvic floor physical therapy can help. A traumatic birth, sometimes enabling that pelvic floor relaxation, and to be able to see what the muscles look like when they're contracting by seeing a little voltmeter attached to the little electrode that's in the vagina can help teach you how to connect mind to muscle in a way that you can't do any other way.
There is a product that it doesn't look so dildo-ish, but it is for in the vagina, and there's an app that you can practice your Kegels with it, and it seems like that's kind of doing something similar, right?
Yes.
Wow. Yeah. Okay.
In the comfort of your own home. But I also have some women who are raised very religious. Who are taught that sex is bad and taught that their pelvic floor, and they have incredibly painful sex because it's just tetanic. Like they have tetanic muscle contraction. And so sometimes, not satanic, tetanic.
Yeah, thank you for clarifying that. I'm I don't think,
it's funny.
I don't even think the Catholic Church thinks that. They just want you to have kids.
We had Nikki Prouse on, and she has all these cool, awesome, orgasm detecting tools, very similar
like
to
the
what you're
butt plug that tells contractions.
That tells you contractions. Yeah, it's wild. We talked about Masters and Johnson, and she said, "Listen, they kind of they got the ball rolling, but they stopped so far out of focus that the work that they're doing now has really been about finishing this up and really figuring out what's going on." And they're using all kinds of fancy
finish.
It's all about the finish.
And finish it up.
And she said because of that, they now have cleanup protocols for the office.
Yeah. Weirdly, they're ripping through cleaning companies. We don't know why.
We were so excited to talk to you, and now
Now we've got to sticky floors.
Yeah. Well, I think there was a conversation about a ceiling needing to be sterilized.
Yeah, whole different shit going on. Yeah.
Just imagine walking in and we're what's raining?
Yeah. Oh man,
that's a whole new something about Mary. It's
I was just thinking that. So I guess my question really that I was really asking first and foremost, because I'm about that age on the male side, obviously, but going through saying, hey, are hormones part of my future or are they not? And I'm real early days in it, but day one, the first thing out of everybody's mouth is this link to cancer. And like, even though a lot of the studies that was based on, we know the black box warnings and all this stuff.
And that was Women's Health Initiative. That was totally the big one. Yeah.
Well, I mean, the Women's Health Initiative, and then the HERS study that was supposed to tell us that there was no heart disease and that it will help you live forever. And that showed exactly the opposite in the first 2 years that you start hormone replacement therapy, or now we call it menopausal hormonal therapy, that there was an increased risk of myocardial infarctions.
Really?
But here's the thing. Hormones are a really nuanced thing. Every single girl, when she goes through puberty, goes through it differently. Does every girl need to be put on a birth control pill to help her with her periods and to regulate them when she goes through puberty? Absolutely not. Does every single woman need menopausal hormonal therapy to stay young or to stay rejuvenated or to
rejuvenated?
I think that's your t-shirt. That's your t-shirt for this episode.
That could be your t-shirt.
Rejuvenated. A kaleidoscope of rejuvenation.
I had this. I had a thought like 10 years ago. There was an anesthesiologist, this like hot ticket anesthesiologist, and she and I would just be like riffing in surgery back and forth, like coming up with all kinds of ideas. And we decided we were going to do a rejuvenation spa in our little town, and we were going to call it Clitique. And we were going to do vaginal.
That's got some
therapy.
legs. That's got some legs. If you ever want to do vaginal Chinese medicine steams, don't call me. Don't call me. No, thank you.
There's a little yoga place not far from me in Warwick, Rhode Island, where they do vaginal steaming.
Interesting.
Yes.
That's the most New England I think you've ever sounded. I know you played that one up, but yeah.
Yeah.
In Rhode Island.
So what happened to the best name play ever?
So with Vajuvenate, well, that's where Vajuvenation comes from. It was
I know, but how come we don't have like a chain of Vajuvenations?
Come on, women in yoga pants coming in and out all day. You'd be so much better.
Right? And then you can get that magnet chair. Have you seen those chairs?
Yes.
I'm kind of obsessed with them.
They've tried to sell that to me. They keep. I have a distributor keep like, hey, just come in. Women come in. They sit on the chair.
Yeah, it's like big money. If you can afford the chair, it buy the chair and the bottoms will follow.
Yeah, and the bottoms will follow. I mean, does this thing work? I mean, I'm curious. Is it like?
Yeah, it actually uses this like quick twitch magnetic pulse thing, and so it's like it causes you to involuntarily like contract your pelvic floor muscles to tighten them. It's supposed to help
the sciencey way of saying she's coming on a chair. Like, is that what you're?
No, because it doesn't bring you. You don't even really feel it, from what I've heard. It's like you're sitting on it.
It's almost like a pulsed EMF, quick almost. Yeah.
Yeah.
Interesting.
It's like really quick twitch fibers. And I have not yet sat in one, but I've heard about them, and I've read a lot of the studies on them, and I think they're really interesting. I like it.
I can literally only think of the Sibian on Howard Stern. Or Sibian. I can't remember.
So what was it? Was it Carmen Electra got on it once, and I missed my exit. I'm going to be honest. Yes. I was like, oh shit, I'm 20 miles away from where I'm supposed to be.
Yeah.
But damn, this show is good.
Oh man. Yeah, it's literally all I think about. I'm like, it's like this giant mechanical bull toy, like, but it like has like a knob that's like just one knob. It's like 0 to like
0 to a million.
Like, I don't know what you're talking about.
Exactly right. I don't know what you mean. Oh my god.
Yeah.
So like, how real is that concern going into this journey? Right? Do you like think of cancer on the on ramp to this sort of as, because like once you're on it, you're kind of on it for life, right? Like, I mean, you're not really.
Well, even more than that, Matt, was the HERS study still looking at Primpro and Premarin as the primary sources?
Yeah.
Okay.
Yeah. So, I mean, this is also where some of the nuance comes in, is that now we have multiple different types of estrogen. We have multiple types of progestogens. Progesterone is one of those. And we can do the fact that Bioidentical and all natural and menopausal hormonal therapy are all sort of lumped in together, and bioidentical is considered only compounded, and is it all natural? And it's all gotten mashed up into, it's gotten compounded into this new structure that is just really complicated for people to understand and to unpack. And that's where a lot of the nuance, I think, needs to come in, and a lot of the teaching needs to come in. So a lot of the natural hormones that people are getting compounded are coming from the exact same pharmacy or from the exact same company as the medications that I'm prescribing. So just because it's compounded doesn't mean that it's natural. A lot of them they're synthesized or semi-synthetic from plant-based hormones. But you can't just take wild Mexican yams, blend them down and get your progestogen. And you can't just take soy and get the phytoestrogen out. I mean, I don't know about you guys, and I say this all the time, but I don't photosynthesize.
Yeah.
I tried it. I tried it once in college. It wasn't my thing.
I need to know how you did that without drinking too much spirulina. But like legit, like you don't photosynthesize, so you can't break down plant estrogen on your own into something that your body is going to be able
usable
to use.
Yeah.
We don't have those receptors. So you can take something like black cohosh, which acts on estrogen receptors, but if it's unregulated, unrestricted, and you're getting 10 times the therapeutic dose of it, then it may cause more harm than good. Versus if I prescribe 0.025 estradiol, which is a bioidentical estrogen, I can write a prescription for a bioidentical synthetic or semi-synthetic estrogen. And if I put up the molecular compound for what estradiol looks like if you draw it out of my bloodstream and what it looks like coming out of a pharmacy, they look exactly the same. Yeah. So bioidentical doesn't mean plant-based. Bioidentical doesn't mean safe. Bioidentical just means it's identical to what my body produces.
Right.
And people just don't always understand that. And so they think they have to go to somebody.
I guess what's the who cares moment in here, or is there one? Because like dumb me goes, well, if they're bioidentical, you know, great. Well, what I don't know is there bioidentical parentheses something else that comes along for the ride?
Well, that's it. That's the question, is that if it's compounded in a compounding pharmacy, who's compounding it? Where are they getting it? How much is in there? And because it's unregulated, they can tell you anything and you have no idea exactly what you're getting. Now, these companies would go out of business if they were all just hucksters and there was nothing there. So I'm sure there's something there, but the question becomes what and how and why, and is it safer or less safe than what you're getting prescribed? That, I mean, we can say a lot about our government, but the FDA does put medications through their paces. And there is regulation, and there are studies in peer-reviewed journals that show that it's effective. There's a lot of women that are going on compounded testosterone now, sometimes because it's hard to get testosterone for women that's dosed appropriately. But the question is, why are we going on testosterone? What are we looking for it to do? And that's the other big thing, is that testosterone is not our primary hormone. What testosterone does in men is very different than what testosterone does in women. Yes, we have some, and yes, we need some. And yes, when our ovaries stop producing hormone, they also stop producing testosterone, although there is a lag. And there's an increase in testosterone over time, which nobody talks about. So women hit their peak testosterone in their 20s. It starts going down in their 30s and 40s, and then starts going back up, which is why women lose their hair, which is why women's voices get lower over time. Which is why sometimes in their 40s and 50s, libido starts cranking up in women. Why? Because their testosterone levels are going back up. So a woman in her 70s and 80s is going to have testosterone levels in their bloodstream that are similar to women in their 30s.
So you're saying the 70-year-olds get a little frisky?
Yeah.
Depends on who they're with and what
I
they're doing.
guess so. We gotta make sure that those square
group.
cells start to elongate.
Yeah.
Right. HIV was for a long time going
I
up
heard that.
substantially in the geriatric population because nursing homes are like summer camp for older people or retirement homes talk about the villages in Florida. They're always looking for gynecologists because STDs run rampant there because no one uses prophylaxis.
Well, no one's getting pregnant, so that's one of the biggest scares, right?
Exactly. So they're not using condoms, and who knows who's coming in, what they're bringing in with them, and then there's lots of indiscriminate sex.
Yeah.
So
listen, I'm not gonna lie to you. If I'm in a retirement home, I'm only having sex, or I'm moving to the next.
Look,
what's the fucking point? Like, dude, I'm in
and honestly, HIV at that age, like something else is probably going to hit you first.
Yeah.
You're going to break a hip long before the HIV takes you out.
Okay,
Yeah.
I'm still going to say you should wear condoms.
You should, but
we should prevent it.
Erica, you're 85 and
I'm
some
all in
smoking
there.
hot dude sexes you up. You're like, you're not going to be running to the nightstand to grab a condom. Let's be honest.
No, you're
totally
probably
right.
going to be running to the
totally
nightstand
right.
to get a Cialis.
Yeah, exactly. Right.
No,
There's
I'm
no
running
fucking
to
way,
the
man.
nightstand to get lube because
Yeah.
there's no
Oh, my
amount
God.
of cell
At the
lengthening
fucking
that's gonna
event,
happen.
dude, Tom, Erica comes up to you. She goes, "You know what I love lately? The CBD lube." I'm like, "I love talking to you, man. I just out of nowhere."
Hey, Erica, you got to try the golden strawberry strain. Let me tell
loves
you.
that.
Oh
Yeah.
my God!
I do not know of this.
So
The golden strawberry strain is supposedly great for your clit. Like everybody,
really?
But it also, like, if you smoke it or you get high on it, it also helps with libido. And I don't know if it was just brilliant marketing by this company down here called Curio, but we bought it. I didn't tell my wife, and that night she was like, "What the fuck was that? That was amazing." And I'm like, "Yeah, that was great." Yeah, and next thing I know, I'm like, "Where's the golden strawberry?" They're like, "We don't have any." What do you mean?
No.
And the bud tender goes, "It works, doesn't it?"
Yeah.
I was like, "Yeah, it does. Yeah, it does."
That's hilarious.
But they make a THC CBD lube out of it too.
Yeah.
Yeah, and I'm a believer. I think it's great. But do you need to take testosterone when you're a 58-year-old woman? What's it going to do to us?
Well, what's your thought about Scream Cream then, which was brilliantly branded too, which is a gel testosterone that women rub on themselves prior to coitus?
And
Wow, I said
what's that
coitus.
supposed to do? You?
You did. That made me feel a little weird, actually.
That felt dirtier than if I said banging out or something.
That's the line, apparently, Tom. We can't say
God
that
damn
one.
it. I went to school with Dominic Chiappetta. Was this fucking gorgeous dude, 6-pack abs, super nice. Every chick wanted him. Good friend of mine. And he would tell me, he's like, "Yeah, so you know that cheerleader I was dating, when we had coitus."
Yeah.
And I was like, "She lets you have coitus with her after you said that?"
Can you just stop saying that word? It feels dirty.
Tom's gonna have a whole ASMR episode where he just says that word into a microphone real quietly.
Yes. And then we'll say ointment.
Oh yeah. People don't like that word.
Moist.
Moist. Yeah, moist will get you.
Funny enough, moist is maybe the most hated word I've ever heard anyone report. I don't know why.
That's why we don't like coitus, because it has a similar
it does have that
moist.
Oist.
Ointment.
Yeah,
It's the oi.
I had a dear friend from college who, if you said moist, she had a visceral, full body cringe. And I used to just love fucking with her because it doesn't come up often. But once you realize that you're like, oh, wait a minute, I should say moist 8 more times.
That's your trigger.
Right now. Yeah.
I just don't like describing cakes as moist.
Yeah.
That kind of that bothers me for some reason. This cake is so moist. Really?
Yeah. That's gross. Please don't.
Was that before or after coitus?
Yeah.
Yes, well,
Yeah, it's
Coitus
more
the
moist now.
Yeah. So I don't know if putting testosterone on just before having intercourse is really going to have a huge impact.
Well, I mean,
when
those
women
drop ship places do it. They sell
I mean, they sell it.
Yeah. And is it the other ingredients that are in there? Is it the suggestive? Is it just the fact that it is lube? Is it
the
causing
Mexican
some
methamphetamines have anything to do with this?
Yeah. I don't know. And certainly
is it mentholated? Is it like who knows what else is there?
Oh,
like,
that sounds the mentholated doesn't. I don't know how I feel about that one.
Yeah,
well,
probably not great.
I don't know what else is in Scream Cream. I mean,
it's essentially just rebranded.
Is it just
gel testosterone? Well, now I got to Google
Erica,
it to make sure I'm not
yeah.
blowing smoke up your ass here.
I'm thinking this was 2001, maybe 2002. We had a little courtyard apartment with only 4 apartments in it, right? And that was it. And we were on the ground floor, and we used to have.
Oh my God, parties. I'm so off.
What do you got?
It's what's I'm going to say this wrong. It's boner cream. It's sildenafil. Oh my God, is that Cialis? Is that?
Yeah, I think it's Cialis
or Viagra.
Viagra, yeah.
Viagra, it's Viagra.
Oh, what's the other one then?
Aminophylline, L-arginine, and pentoxifil. See, so here's why I didn't become a medical doctor. Chinese sounded easier
than 13 syllable.
But yeah, no, it's Viagra. It's Viagra cream. Mm-hmm. It's not.
So it causes vasodilation.
Yeah,
that's
pretty much
what it's doing. Yeah.
Ergo, Scream Cream. We had this awesome party, Erica, and it was right at the time when Dave's Insanity Sauce. You remember this crazy shit?
Oh my God.
Where the Scoville unit was introduced to the world. Okay, so Dave's Insanity. So the Scoville unit is a unit of measure for the spiciness of peppers, and it goes from 0 all the way up to
several billion.
Oh God, I have a feeling I know where this is going.
So Dave's Insanity Sauce was the first marketed million Scoville unit hot sauce. And the thing was, is if you took the tine of a fork and dipped it in Dave's Insanity Sauce, wiped it off on a napkin mostly, and then put the last half of that on your tongue, you would need like a gallon of milk to get this out. I mean, it was pervasive, right? So, and a little tiny bit. So we go on this Who's Got Bigger Balls. We're all tasting it. We're all hammered. And a couple leaves. And all of a sudden, we don't think about it. Couple minutes later, somebody who was with us rubs their eye and goes into fucking heart palpitations. They're like screaming. We're like, whatever. And we're like, what the fuck? And they're like, I don't know what's happening. Fucking, I don't know what's happening. So, in our early 20s, armchair medical doctors, we're all like throwing out theories left and right. And somebody's like, oh my God, do you think that had anything to do with the Dave's Insanity Sauce? And everyone had this like aha moment. We're like, oh fuck, it definitely did. And then somebody goes, oh, fuck, and like goes and calls him on his cell phone, and he picks up the phone and he goes, we're already in an ambulance on the way to the hospital.
Oh my God.
They left to go have sex. We all knew that they were like leaving to go have sex, and it did not go as planned. So Scream Cream has
that sounds awful.
It was from what I understand, it was not super comfortable.
Yeah. Wow. Wow.
Screaming for all the wrong reasons.
Ask your brother about some of these mentholated products that we use topically in the clinic. And at least once a month, I will either rub my eye after putting them on a patient or go to pee.
Yeah.
And I will wash my hands twice before I pee. And still I walk out and go, I just grazed it. Why is it burning? Why is it burning so much? Why? And then you got to stand there and be cool. Well, you got to stand there and be cool because you can't let people know you just burnt your dick with menthol.
Yeah, well, you can stand there and be cool for sure. Real cool. Very, very cool.
I don't know if I want to have that conversation with my brother.
No, I don't think you should.
Have you ever put menthol
have you
products
ever
on your
accidentally
junk?
got Posamon on your penis?
Yeah.
Yeah. Did you ever go to the bathroom
That's
after?
not quite what you.
I was talking to Tom.
Tom wants to
who-
know if you ever accidentally slipped with the woodlock oil.
Yeah.
Writing down.
Yeah. Well, that could be his
oil.
T-shirt if he ever comes on, and it could be, something about woodlock oil on my junk or something like that. Like I
Dude,
can
the
see
fact
this
that it's
forming.
woodlock.
I know,
Like, does it
Feels
really?
So
feels
it's
oddly serendipitous.
it's extra little ingredient, and it's a really great formula actually. And I don't know why we call it woodlock, because it's wong to yik in Cantonese. But yeah, none of those words mean wood.
Yeah.
But it's got wintergreen in it, and it's like this brilliant green. It like you walk out and you just like you smell so wintergreeny. I don't know how else to describe it. It's very strong though. They I don't know if they said how much menthol is too much for a human. Let's just back it off a little.
Let's just go one drop south of that.
And then they got
Just-
methylsilicate in it, which is similar to salicylic acid. So but it doesn't go transdermal, or it doesn't get into the bloodstream. So you don't have to worry about it thinning the blood. It really kind of relieves the inflammation too. It's a great one.
that's cool.
Yeah.
So maybe not about his junk, Erica.
Yeah, don't put it on your junk.
Yeah, don't do that.
No, but
Don't do that.
on your shoulder.
So
on your frozen shoulder from
on your
menopause.
frozen shoulder from menopause.
Yeah.
So where are you going now from this place? Like you're
She's going to Portland. She's got to go to the screening in Portland.
Yeah.
No, I feel like it's sort of like the Grateful Dead. I'm just going to follow.
Yeah,
this
just follow
movie
Suck It Up
everywhere it
Buttercup
goes.
around the country. Yeah.
How cool would it be if we just had mobile clinics that just followed the movie around?
Yeah.
Well, like the RAM clinics that they talk about. In the film.
Yeah.
I actually went to one. That's when I met Todd Otten for the first time.
Oh, wow.
Was at a RAM clinic. He was like, "Hey, I'm going to be up in Natick." And the crazy thing is that there was a RAM clinic in Framingham, Massachusetts. So 20 minutes outside of Boston, the mecca of healthcare, where you have Mass General, you have Brigham and Women's, you have Tufts Medical, you have these major centers, massive hospitals. 20 minutes outside of there were probably 20,000 people that were uninsured or underinsured that were getting treated at a RAM clinic in a technical high school. It was the most insane thing I had ever seen. I was there the day that they were setting up. And when I tell you they had, the little optho machines, like when you go to the eye doctor, it's like one or two. They had 20 of those in each room in 3 different classrooms. And they were getting ready, and they had it was going to be fully staffed with doctors and techs and ophthalmologists and optometrists that were going to be seeing people. They had dental clinics that they were setting up with full-on tents for anesthesia to be able to pull teeth, or they were all sterile. It was wild. But the fact that it was 20 minutes outside of Boston was insane to me.
It's kind of heartbreaking.
It is.
Yeah, that's a little crazy.
Yeah. If you've never been to one, seeing one changes you a little bit. Like I can't wait to participate in one. I couldn't do it because I'm not licensed in Mass. So as a Connecticut licensed person, and there weren't any in Connecticut. So it was a very tragic but inspiring moment. Like I can understand why the insurance executive from the movie was so blown away by the RAM clinic that he went to, that it was life-changing. It was a call to action.
We got to get him on the show, Matt. I know we talked about that.
He's definitely a great person to talk to. I'd love his perspective on just what that's like to go from one side of the fence to the literal opposite
to
side
grow
of the
a
fence.
soul.
Yeah. I mean, it's just a wild story. But what I like about him more than anything, and I know we're getting late on time, so I want to wrap up with Erica.
Oh yeah, we'd sit here for another 3 hours.
What's interesting about him is that he knows how to actually do it because he's seen it from the other side. So his ideas are not theory. They're not
Right.
They're not question marks. They're not hypotheses. They're like, no, this is how you would do it. Now, granted, there's nuance to it and all that, but like his shit's pretty fucking surgical, pun intended. You know what I mean? Like it is real fucking dialed in, you know? And
yeah, he's like a spy. Like
he
really has all
is.
the inside information, and then he's
a
double agent. That's
and he's really kind of right now, maybe not N of one, but N of few. You know what I mean? Like there's not a ton of him running around right now, you know?
It's true.
You know,
so I'll talk to you guys next month.
Yeah,
sure.
For our monthly.
We'll send you the Calendly link.
What because we got to talk about you a little bit here.
Do you want to do the commercial?
Like, yeah, let's do a little bit of your commercial.
The commercial. Commercial is still The Girlfriend's Gyno, and I'm on Facebook, Insta, and TikTok. And also at thegirlfriendsgyno.com. I have a website with additional information. A lot of it is free. I have some blog posts there. There is a little bit of paid information that's just longer form. But it's really just informational about everything from pregnancy to puberty to menopause, working hard to just educate that pap smears aren't painful or they don't have to be, how to talk to your doctor. I also love doing workshops on a big scale, on a small scale. Public speaking is something that I love to do. So education is really my foundation moving forward and what I'm striving to do.
Yeah, and I love talking to you because you're so at ease with what you do in a way that's so like deeply fluid. You know what I mean? Like it's so easy to talk to you about this stuff.
I think it makes people process it so much better, right? It's so much
exactly
easier when it's relatable and I can understand it and it's fun and it's upbeat, you know.
And you know what the shitty part about the 80s was, you know, and I was younger then about everything.
Where do you start?
The rampant capitalism, that started all this fucking medical bullshit.
It was so yes. You know what though? The version I was talking about was like, it was so overly medical and complicated to scare the shit out of you. Like they used big words, they used terms no one understood, they explained it in very sinister ways. And so like a pap smear was like a fucking thing that you didn't want to have happen because it was almost vilified. And I'm not just talking about pap smears. This is any medical thing almost. Like it was like, if it wasn't your annual fluoride cleaning at the dentist, it was like, nope. We're not talking about that. Like, you know,
well, it's very paternalistic. It was, you're going to do this because I say so.
Yeah.
And because it's the right thing to do. And I'm the doctor. And then they also, I mean, doctors abused the system in the 80s.
No, 100%.
They were making bank for everything. They were buying their own x-ray machines and everyone was getting an x-ray, whether they needed it or not, because they could get paid to do the x-ray. So there was huge abuses of the system in the 70s and early 80s. And then they started tamping it all down. And then insurance companies were like, dude, we're buying in on this. So, you know, they kind of strip the fat off the cow.
Yeah. Well, I mean, and now, honestly, I think you get a lot of people that have hangovers from that. And it's not necessarily directly, but it's generational because their parents don't want to fucking talk about it because they were like, nope, fuck that. I'm not going near that thing with a 10-foot pole. And now they're like, oh, but I got this internet thing in my hand and I can fucking chat GPT, the PhD answer to any fucking question under the sun. And this is very confusing to me, you know, and it's like, so people who could talk about it openly and freely and fluidly and be able to respond intelligently sort of with the wild volley of possibilities that conversation could go to is unique. And I think that's what I like about talking to you. So.
Well, thanks. I love talking to you guys. This is fun. You made my night.
Yeah.
Well, you made mine too, man.
All right.
Love it.
We are going to apparently have you back. Like, let's just do that. I mean, right?
Yeah.
I mean, at some point we got to
totally. Matt and I are just going to talk to the same 4 people every week. I think that's what we're going to boil it down to.
What I really want to do though and I want to invite you to do this, is that I think we need to figure out how to get a little master series with you and like you and your pussy or something fun. We could come up with a good name.
Well, not yours per se, Doc.
No,
but like if you want,
like a little series, like make it fun. You know what I mean?
Tongue
like,
in cheek.
Yeah.
No, not the cheek. A little anterior.
No.
Yeah.
We'll call it rejuvenation.
Rejuvenation.
Call it.
I really would like you to materialize the rejuvenation chain of wellness centers, for
Wouldn't
God's
that be
sakes.
great?
The clitique.
The critique. I mean, come on.
Instead of critique, it's the
I
critique.
get it.
Yeah.
Listen, I mean, come on, man. The story
the-
writes itself. You got some doctor
Right?
friends. Put this shit together already. We'll go do an episode.
The clitoral kaleidoscope
Oh, there you
with
go. See?
Kesselman. Kesselman's clitoral kaleidoscope.
Oh my God.
That's alliteration. It's got everything.
I mean, you're checking all the boxes.
I think that's it. I think the shit's writing itself now.
Yeah, I mean, this is on autopilot. Are you an AI? I mean,
Yeah,
seriously,
this might all be AI. We don't know. It's all a fucking hologram.
Yeah.
No, I was an English major.
Yeah. All right, people. Love you all, but we got to go. Let's do it. Talk to you guys later.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.